irregular surfaces is also possible because of inversion and eversion. Alright, because the foot is not solid structure, it is made up of rubber, so inversion and eversion is also a possibility. And when the patient is made to bear walk on a irregular surfaces, it can get accustomed to those irregularities without any feel of a fall. Alright, so these are the advantages. Another advantage is that it is near normal looking foot. It appears like a normal foot, near normal appearing foot. Alright, so these are the advantages, which is a great psychological advantage on the part of the patient. So these are the advantages because it is made up of rubber. Squatting is possible, dorsiflexion is possible, inversion, eversion is possible, wear and tear is less, and it is least expensive kind of the prosthesis available in the entire market. That means all over the world. It is considered to be the least expensive terminal prosthesis. Alright, so these are the advantages, and these advantages actually are the disadvantage on the part of the solid ankle cushioned heel type of a foot, that is sack foot. So this is terminal prosthesis that you have to be aware of. And finally, you know, a table just named sequestra in the form of a table. Particularly, it is helpful in the form of a one-liner. They can ask this question about a named sequestra. Alright. So the topic is eponymous sequestra. That means name sequestra. Now, under the heading of amputation, we are talking about this. Why? What is the reason? Just try to understand. You know, if a bone is sectioned like this, and now this is the terminal end of the bone. Alright, this is the amputated end of the bone. So it is the amputated stump. It is called as stump. Now, is this not a possibility that this stump might get necrosed because of avascularity? So this necrosed region of the bone is known as sequestra. So we are having eponymous sequestra, means multiple other condition can lead to these kind of these sequestra, and based upon their appearances, they are given a different names. Alright. So the first one, like tubular sequestra. Tubular is also known by the name of pencil sequestra, and it is a feature of chronic osteomyelitis. As we are going to study, in case of chronic osteomyelitis, we will be having a detailed version of what the sequestrum is, or the necrotic segment of the bone, or the necrotic piece of the bone is. Alright. Then is the ring sequestra. Now this ring sequestra is a feature of amputations. Just now we have talked about the amputated stump could be converted into a ring sequestra, or external fixators. You know, when the bone is fixed with the external fixation, and where there was an entry of the Shan's pin into the bone, that region might get necrosed, leading to a ring sequestra. Then the third one is coralliform sequestra, which is a feature of coralliform sequestra, which is a feature of Perthes disease, Legg-Carl-Perthes disease. We will come to know what exactly Legg-Carl-Perthes disease is, but at this point of time, you just have to remember, as I told you, these are the eponymous sequestra that you have to remember. Then a black sequestra. Black sequestra is a feature of a gunshot as well as actinomycosis. Alright. This is something that you have to mug up. Then there is a rice grain and the coke sequestra. Rice grain or coke sequestra, which is considered to be a feature of tuberculosis. Then we have got feathery sequestra, which is considered to be a feature of feathery sequestra is a feature of syphilis. Alright. Then we have got matchstick sequestra, which is considered to be a feature of sickle cell disease. Alright. So at least these are the names of the sequestra that you have to remember. Otherwise, there are multiple other kind of the sequestra, but most commonly what are asked is the coke sequestra they have asked, feathery they have asked, ring sequestrum they have asked, pencil tubular sequestrum is something that they have asked in the form of a one line. So this much you need to remember as far as the principles of the amputations are concerned. We have talked about the indications, we have talked about the terminal prosthesis, we have talked about the named sequestra. We have talked about the mangled extremity severity score. Very importantly, they used to ask about. And obviously the eponymous amputations, only 4 of them, like Syme, Sermancio, Chopart, as well as Lisfranc amputation. So hope you find it helpful, and it will be proved, it is going to prove helpful in your upcoming examination, this topic in particular.